Good teacher. My college, Caitlin Quintero, and myself, Christian Blades, we are pleased to introduce you to the exposition of the alcohol and tobacco. I hope you like it. Hi, my name is Christian Blades and I go to expose about the tobacco and cigarettes. First, what is tobacco? Tobacco is a plant that is grown for its leaf, which are dried and fermented and then used in various products. Like a cigarette are the most popular way to use tobacco. It is a dried mindset plant wrapped in a thin, cylinder-shaped sheet of paper. It has been used for millennia and has its origins in the American continent from where it spread to Europe in the 16th century and later to the rest of the world. It is legally marketed throughout the world, although in many countries it has numerous consumption restrictions due to its adverse effect on the public health. Among the numerous substances in this consumption, tobacco includes an alkaloid that is found in the leaves in variable proportions. Nicotine, a highly addictive substance that is associated with a series of negative health effects and that in high doses is potentially lethal. What are the effects of tobacco in the brain? By consuming tobacco in any of its forms, the nicotine it contains is rapidly absorbed into the bloodstream. Once it enters the bloodstream, nicotine immediately stimulates the adrenal glands to release the hormone epinephrine. Epinephrine stimulates the central nervous system and increases the blood pressure, respiratory rate, and heart rate. Like drugs like cocaine and heroin, nicotine increases levels of the neurotransmitter chemical dopamine, which affects parts of the brain that control satisfaction and pleasure. Health risks. Tobacco use is a risk factor for many diseases, especially those that affect the heart, liver, and lungs, as well as many types of cancer. In 2008, the World Health Organization defined tobacco as the world's leading cause of preventable death. At the beginning of the 21st century, the World Health Organization estimated that tobacco was responsible for more than 5 million deaths each year, about 100 million deaths throughout the 20th century. According the World Health Organization estimates if current trends are followed, the number of deaths from smoking could rise to 8 million annually by 2030, reaching an estimated 1 billion deaths throughout the 21st century due to tobacco. Since the 1990 legislation has been promoted in developed countries, international initiatives such as Framework Convention for Tobacco Control to curb its consumption, although worldwide this has increased in recent decades, especially in developing countries, while in developing countries it has stagnated or declined. Lung cancer and lung disease. Smoking is the leading cause of death from lung cancer. In addition, smoking causes disease such as emphysema and chronic bronchitis. Smoking also makes asthma worse, also other types of cancer. Heart and circulatory system problems. increase the risk of dying from heart and blood vessels. Disease includes heart attacks and stroke. If you have a blood vessel disease, such as heart failure, smoking makes your condition worse. Diabetes. Smoking increases insulin resistance, which can pave the way for type 2 diabetes. If you have diabetes, smoking can accelerate the progression of complications, such as kidney disease and eye problems. Eye problems. Smoking can increase the risk of serious eye problems, such as cataracts and vision loss from muscular degeneration. Infertility and impotence. Smoking increases the risk of lower fertility in women and the risk of impotence in men. Complications during the pregnancy. Mothers who smoke during pregnancy are at higher risk of preterm labor and giving birth to lower weight babies. Disease of the tips on gums. Smoking is associated with an increased risk of developing gum inflammation and a serious gum infection that can destroy the supporting system of the teeth. That's called periodontitis. There are 8 basic recommendations for those who wish to stop this addiction. Number 1. Have the will or purpose to keep smoking by deadline. Number 2. It is important to eliminate or reduce the factors that are directly related to this habit, such as ashtrays and pipes and lighters. And number 3. Make the home smoke free, for which no one should smoke inside the house, not even the guests. Number 4. Carefully analyze the elements or situations that lead to smoking again, to avoid them. Number 5. It is very important to have the support and encouragement of family and friends. Have some studies have shown that people who can want to quit are more likely if they have help. Number 6. Change the routine associated with smoking and undertake new activities that reduce the anxiety caused by quitting smoking. For which, for example, you can take a hot bath, exercise, read a book, or find a distraction that contain the desire. Number 7. See your doctor or a smoking support center. That can help too much for the people who can do this. Number 8. Be prepared for difficult situation in such as way to avoid relapses, such as the loss of a loved one. Health risk of passive smoking. Who are passive smokers? Thus, people who, without being smokers, are frequently exposed to air polluted by tobacco smoke. Tobacco is formed by the smoke that is given off from cigarettes and by the smoke that the smoker expels after smoking. It is even more harmful than the smoke inhaled by the smoker because it contains higher concentrations of harmful substance. This has a higher risk for heart attack and heart disease, lung cancer, sudden and severe reactions including in the eyes, nose, throat, and lower respiratory tract. Babies and children who are often exposed to secondhand smoke are risk for attacks. Children with asthma who live with a smoker are much more likely to visit an emergency department. Uh, Infections of the mouth, throat, sinus, ears, and lungs damage, poor lung functions, sudden infant death syndrome.
Hello teacher, I am Caitlin Quintero and then I talk about the alcohol. What is alcohol? Alcohol is a drug that represents the central nervous system, namely its low down brain functions. Alcohol affects self-control so it can be mistaken for stimulators. The main component of alcoholic beverages is ethanol or ethyl alcohol, which have different concentrations depending on their production processes. Alcoholic beverages may include fermented wine, beer, and cider. These drinks have a graduation between 4.0 and 15.0. They are produced by fermentation of sugar or cereals. Distillates. They are the result of distillation of fermented beverages, so they have a higher concentration of alcohol. Oreo, Pacharán, vodka, whiskey, rum, brandy, or gin are between 40.0 and 50.0. What immediate effects does alcohol have on the body? Okay, alcohol ingested in a drink is absorbed into the digestive system, from where it passes into the bloodstream, in which it can stay for up to 18 hours. A few minutes after drinking, a number of effects may appear, the manifestation of which varies depending on the amount you drink and the characteristics of the person. In order to appear over time and in relation to concentration in the body, these effects are as follows. Number 1, disinhibition. 2, euphoria. 3, relaxation. Others could be difficulty speaking, motor and coordination, and finally, acute poisoning. In cases where the concentration of alcohol in the blood reaches or exceeds 3 grams of alcohol per liter may appear to be aperitif and Johnson's coma or every date. What influences the effects of alcohol? The effects of alcohol depend on the amount consumed, but there are other circumstances that can speed them up or aggravate them. Age. Young people are more sensitive to the effects of alcohol on activities related to planning, memory, and learning, and are more resistant than adults to sedative effects and motor uncoordination. Weight and sex. Alcohol affects people with less size more severely. In general, the woman's waist length and the size of her internal organs is proportionally smaller. Therefore, fewer amounts of alcohol can cause damage to the body more quickly. the amount and speed of intake. The more alcohol drunk and the shorter the chance of poisoning. The combination with carbon beverages such as tonic tails accelerates poisoning. The food ate at the same time as drinking, especially fatty foods, slows intoxication but does not prevent or reduce damage to the body. The combination with other substances, if tranquilizer, relaxing, or soothing are taken, the sedative effects of alcohol are enhanced. When combined with cannabis, the sedative effects of both substances are increased. When to avoid alcohol. In certain situations, the risks of alcohol may outweigh the possible health benefits. For example, ask your doctor about drinking if you are pregnant or trying to get pregnant. You have been diagnosed with alcoholism or alcohol addiction, or have a strong family history of alcoholism. You had an hemorrhagic stroke, with a blood vessel in the brain leaks or breaks. You have liver or pancreatic disease. You have heart failure or have been told you have a weak heart. You take prescription or over-the-counter medication that can interact with alcohol. Teenagers and alcohol. It is common to experiment with alcohol and drugs during the teens. Unfortunately, adolescents often do not see the relationship between their action today and the consequence of tomorrow. They have a tendency to feel indestructible and immune towards problems that others experience. Using alcohol or tobacco at a young age increases the risk of using other drugs later. Some teens experiment and beat and stop using them or continue to use it occasionally without significant problems. Others will develop a dependency by using more dangerous drugs and cause significant harm to themselves and possibly others. Problematic usage addiction. Addiction is a complex and variable process that depends on many factors, so there is no specific time or moment from which a person can consider addiction. However, it is common for the time to be reduced when variables such as greater amount of consumption, greater frequency of consumption, less distance between doses, younger age of the consumer, prolonged consumption, personal vulnerability are added. At the social level, one must take into account environmental factors that include economic development, the culture of normalization of its consumption. Regarding individual risk factors, there is no single risk factor that is clearly dominant, but the more vulnerability factor converge on a person, the more likely that person will develop alcohol-related problems. as well, and it happens when satiated substance. The concept of risky consumption is difficult to agree on as it depends on the type of consequence that is being evaluated to establish the rates. For example, the same creature cannot be approved for drive vehicle as or cardiovascular disease. A risk consumption, however, the style is more likely that those who practice a certain style of consumption develop health problems caused by alcohol. In addition, it is possible that the body already suffers from some disorder even if the interested party does not perceive it.